Hello everyone and welcome to this webinar, Preparing for Joint Replacement Surgery and Recovery. My name is Mark, I'm the Services Manager for Arthritis Action and I'll be performing the moderating duties today. Now, before we get underway, I have a few housekeeping items for you. So you'll all be muted throughout the webinar. So if you have any questions for either of our speakers, please type these in the Q&A box and we'll endeavour to answer as many of these as possible during the time allotted. We'll save the questions until the end. But in the event that we do run out of time of that, we will answer by email within a few days. So please bear with us on those. Finally, to remind you, this webinar is not a substitute for medical advice, so always consult your doctor or medical professional for any questions regarding your own medical conditions. So now that's out of the way, let's introduce you to our speakers. So first up, we have Dr. Wendy Holden. So Wendy is an honorary consultant rheumatologist at North Hampshire Hospital's NHS Foundation Trust, specialising in arthritis and pain management, and also the medical advisor for Arthritis Action. Hello, Wendy.
Hi, Mark, and here we go again. Nice to see you.
Lovely to have you back, as always. So, and also joining us today is Rebecca Sadri. So Rebecca is a university lecturer and Arthritis Action volunteer. She's also a long-time attendee of our online Arthritis Action groups and has recently had bilateral hip replacement surgery. So, hello, Rebecca.
Hello, good to see you all.
Excellent, thank you. So Rebecca, I've given a very brief bio there for you, but I was wondering if you could tell us in a bit more detail about your experience with arthritis.
Yes, okay, Mike, thank you. Thank you for the opportunity and thank you for everybody who's joined this. I used to be very, very fit. I love exercising, absolutely addicted to it. I used to do classical ballet, dance, yoga, all sorts of things. And then suddenly I was having a great deal of pain in my right knee. And I went to my GP. I was referred to the physiotherapist. They did some investigations. There was some wear and tear. They gave me physio exercises. They didn't work. To cut a long story short, they offered to either give me a cortisone injection or refer me for surgery. I chose the cortisone injection as it was a better middle ground, I thought, and it had no effect whatsoever. So then they started investigating the hips, and they discovered that the hips were beginning to get into really bad shape. And within a very short period of time, about 2.5 months, I went from mild arthritis in my hips to very severe arthritis in the hips. No idea, nobody can tell me why and what happened. And I was referred for surgery. When the surgeon saw the x-ray that they took on the day of the consultation, they told me that this was an emergency and they would want to do the surgery as quickly as possible. But the good news was that they were prepared to do both hips at the same time. And I jumped at that opportunity, you know, get both of them done. So I wasn't limping just with one good hip and one bad hip. And within 5 or so weeks of the consultation, I had the surgery. And I have to say it's been extremely successful. You know, pain went away. Within days I could walk. So for me, it was a shocking experience beforehand that I got into that degree of arthritis for seemingly no reason at all. But the surgery and the post-operation has been extremely positive. And I'm very grateful for everybody who's helped me in the process.
Excellent. So what was the timing of all of that, Rebecca? How long was it between you developing that knee pain then and you getting your surgery?
So the knee pain, there was a mild knee pain for a while, but when I thought that maybe I should get it investigated, it was July. And I was referred then finally in December for hip surgery. So it was during that period. And in January, I had the hip surgery.
So that was pretty quick, wasn't it, by current NHS standards, I would imagine. I guess that reflects the severity of your problem, and that probably the place you had has got an excellent service by the sound of it.
Absolutely, yes. It was, I think 5 weeks was remarkable. I mean, it sounds quite a long time, but I think, as you say, at the present time, that is a very quick turnover. And when I went for my consultation, as I said, they took an X-ray before I saw the surgeons. I then saw 2 surgeons and they consulted with one another. And they decided that it was an emergency and they wanted to do the surgery as quickly as possible. And there and then, after seeing the surgeons, I went into the next room where they did the pre-op measurements. So they took blood pressure, they take ECG, they took my weight, they took a blood sample. So they did all of that pre-op. So normally people will have to wait to get a phone call to go in again to get a pre-op. But for me, they did all of that so that as soon as a slot would become available, they could just wheel me into the operation room, basically.
When you were told you needed to have surgery, that must have come as a bit of a shock. Is that right?
It didn't really, by that time, I mean, I was in such a shock about how much of my life I was losing. I was working full time. I loved movement, exercising, dancing, all sorts of things. And I had lost it all. So I was completely prepared to do what was necessary. And by then I had read enough around the subject to know that it had to be surgery. I had tried my absolute best with physiotherapy. So the sort of mantra that I had heard was that for arthritis, you do physiotherapy, you then go for cortisone injections, you then go for surgery. And there was no point in trying cortisone injections in the hips. I knew that, the state that they were in. So it wasn't a shock that I needed surgery, but it was a shock from July onwards that this had happened to me.
And so quickly. Yeah.
Yes.
Were you given any other options when it comes? You mentioned cortisone injections already, but like, was it just you have to have surgery or nothing else, or were there other avenues that they offered you as well?
So before the surgery, there was a sort of succession of physiotherapists. They seem to have some ranking, physiotherapists and then the advanced practitioners. So I was already in touch with the advanced practitioners in the physiotherapy practice, and they had talked me through about the benefits and what they understood of cortisone injection. And I reject, they were not particularly recommending it. They thought that it was less effective for the hips than for the knee, and for my knee it had no effect whatsoever.
I think it can
And
sometimes work if the arthritis isn't too bad, but if it looks as though the arthritis is severe and you're going to need surgery anyway, I think some surgeons would prefer just to crack on.
yes, and I decided that they should refer me to surgery. And if in the meantime there was, I decided to do something else or some miracle happened, I could always cancel the consultation. But, unfortunately, no miracles happened, and I did go for the consultation. By then, I welcomed the surgery, and I absolutely welcomed their offer to do both hips at the same time. It did not frighten me at all.
Excellent. That's great there. Great there. So could you tell us a bit more about what prep work you did? Like what kind of prehab or like pre-rehabilitation you did leading between that point when you were referred for surgery and when the surgery happened? Did you change anything? Is there anything extra you did to help prepare yourself?
I actually did a lot from when I felt that the physiotherapy wasn't working, even before the consultation. So there were 3 things that I had 3 goals. One was to keep as fit as possible and keep my muscles as strong as possible. because, you know, I had no idea what the surgery was going to be like and what the post-op was going to be like, but I was sure that I would be in better shape for recovery if I kept myself fit. The second thing was that I wanted to keep myself as informed as possible. I wanted to find out everything. I never had the courage to actually watch a video of what the surgery was like. I only had the courage to do that, you know, months afterwards. But apart from that, I wanted to find out everything possible about the surgery and about post-op and pre-op. And the third thing was that I had lost my life, basically. I had lost my activities. So I had to find a way of keeping myself occupied so that I wouldn't get bored, I wouldn't get despondent, I wouldn't get depressed, I wouldn't eat too much food, you know, to put on weight and lose my fitness. So I had these three goals and they fitted together very well. So my physiotherapist gave me a comprehensive set of exercises. I think there were about maybe 16 exercises. And as I'm sure everybody knows online, with physiotherapy, the exercises are simple, but my goodness, how many times you have to repeat everything, you know, you have to do 3 sets of 30 and, you know, which was great. You know, that was part of my day already occupied. I would put the radio on or some music or whatever, and I love exercising. So that was one thing. Very comprehensive exercises to strengthen all the muscles basically from the waist down. And I would do them one by one. Some days I would alternate. I think that was the advice. I'm also, I've done yoga all my life, so I managed to keep up my yoga somehow. I remember on the morning of my operation, I was doing sun salutations. So, you know, it doesn't need to stop you
That
if
is
you're
incredibly impressive, Rebecca. Doing
Yeah.
a sun salutation on any morning is impressive.
And, you know, one of the absolute benefit, and the surgeons were amazed that even though I was bent double, I had to walk with crutches and I was bent double, but I had no upper back pain at all. I had no stiffness, no pain in the shoulders, in my back, in the small of my back. And I think it's the yoga. And you know, okay, I was used to sun salutations, but I think any little bit of stretching would help. You know, keeping all those ligaments and cartridges and whatever just oiled and stretched, I think would help. I also meditated, although meditation is a cheat word for what I did. You know, I would just sit comfortably, close my eyes, breathe, and let my mind wander. Some days I would do it for 5 minutes. Some days it was so enjoyable, I would just stay like that. It was nice and cozy and warm. And sometimes my mind was still. Sometimes it was just, you know, whizzing around, zigzagging around. And that was okay. That was okay. I did a lot of my planning and organizing that way, actually, you know. Not getting worried, just breathing, closing my eyes and letting my mind get on with it. And I discovered it had a wonderful way of getting itself sorted out. So
Okay.
those were the sort of physical and mental activities that I did. And of course, I had to walk. I would walk, but that became more and more painful. I would walk in the street, then I was limited to walking around my garden, then I became limited to walking around my flats, you know, like a mad woman just marching from one room to another. But it helped, and I felt better for it, even though I had to take the paracetamols, you know, to bear doing it.
Uh,
Sorry, Wendy, did you want to
No,
say?
I was just going to say to Mark, what would you say to less superhuman beings about exercise before surgery? That's incredible, your story, Rebecca. 10 out of 10, 10 out of 10 for that. So lots of people find it difficult to motivate themselves and also to just kind of keep it up when they're waiting a year sometimes or more for surgery. What do you reckon?
Yeah, so I think one of the most important things to do is to still continue to move and engage your muscles, because it doesn't have to be anything big. I mean, like if you're only able to do a sun salutation, I mean, literally the morning of surgery, I'm still in awe of that, Rebecca. It's incredible. I love yoga. I'm a huge fan, and me doing that first thing in the morning feels like a massive ask without needing hip surgery. So, but yeah, as long as you're still using your muscles and trying to use your body as much as you can, because it's difficult to do, of course, but even like just the smallest bit is better than doing nothing. So as long as you're still doing things, whether they just be stretches or seated exercises as well. So I remember you, you telling me before, Rebecca, you were a big fan of seated yoga as well.
Yes, yes. I mean, coincidentally, I had joined a 6-week program in a local organization where they allowed me for free to go and try everything. And this is an organization that caters for people over 60, over 50. And they had all sorts of classes for people who had had strokes, for people with very limited mobility and so on. So it was very fortunate that I had that opportunity. So I tried their chair-based sessions. So chair-based yoga, chair-based Pilates, chair-based, even the stroke exercise, although I was so used to the exercise that this wasn't doing a huge amount to get my heart and lung going. But as Mark said, just even the tiniest bit of exercise, had some effect. It would get some blood going, it would get the breathing deeper. So I learned how exercises I was used to could be modified. And actually, to varying degrees, they could be hugely modified if you have mobility and you don't want to stand up and to walk around. So that was excellent. And then I discovered that all sorts of resources are also available online for these kinds of modifications.
Another really important thing you said there, Rebecca, was about keeping informed. So I presume you asked your surgeons lots of questions about the surgery and the what to expect and so forth. And I think that is incredibly important as well, because I think you said that you said earlier that they had put in a special implant for you, hadn't they, to keep you a slightly bigger one than they would normally use, for example.
Yes, you're absolutely right. I think that you have to tell them what you want, how you feel, and obviously they're busy people. And so you have to do your homework, I think, ahead of time. So you don't sit there, mulling over what you're going to say next. I always went with a list, actually,
Yeah, great advice.
to discuss with them. And I had told them that, look, what I want you to do is to help me go back to my dancing, to my yoga, to my swimming. And that's what I want. I don't just want to be able to walk minimally. And yes, the surgeon then told me that he had given me some special larger sort of implants instead of the bones with maximal mobility, range of movement. He still went white when I told him, would I be able to do the lotus position in yoga? He said, be very careful about that. But absolutely, yes.
So what support were you given through all of them? I mean, you've mentioned like the physiotherapy and I said the implant, but were you given sort of like any additional support, like things around the home or anything to like before the operation?
Right. So that was my information gathering stage. So I looked everywhere I could find, to find out what support was available. And I have to say, I was astonished at the amount of support that's available and for free. So my first port of call was that organization with whom I'd done these chair-based organizers. This is a guild. Now, I don't know if everybody has a guild in their local area, but I was lucky to have one. I think there are a few around elsewhere. I realized that they also, apart from exercise classes, they have all sorts of things, and they provide me with a wealth of information. about what was available. So for example, the local council, I realized, could provide me with a lot of help. It was during this process that I came across Arthritis Action, and I became an absolute addict to the online sessions. I find them extremely, extremely helpful. Just sitting there and looking and listening to people who had similar problems, I think was very helpful. And there was a lot of practical information. And I think above all else, I made a very, very good friend, and we still communicate, and she provided me with so much support and practical help that I will be forever grateful. Then the local council I discovered has occupational health. So I got in touch. They came and they sat with me, and they also took me through all the activities I needed to do around the house. And they recommended a lot of kinds of equipment. And they then followed up. They arranged for various things to be delivered to me. So for example, for getting in and out of the bath, they arranged for 3 different kinds of equipment to be delivered to me for me to try. And the deliverer would come and would install it, and the occupational health person would come and would show me how to use it and would watch me use it safely. And then in 2 or 3 days' time would call me to see how I got on. And it so happened that the 3rd equipment for bath was the one that I could use very comfortably, and I still have it. I still use it. It's so nice to use. And so on, they brought me perching chairs and all sorts of things. So that was the local council. And it turned out to be the local council who also would provide home help. I knew that I would need, after discharge from hospital, I needed help. I needed something arranged. And the day I was discharged, somebody from the local council came over to my flat, and the day after, the home help arrived. So that was incredible service, I have to say. And twice a day, then somebody would come and help me with various things I needed to do. They also provided post-surgery a personal alarm for me. It's the sort of thing, it's a little button you wear around your neck or around your wrist. And there is a box that comes with it. So if you press the button, you immediately get connected with these personal alarm people who share the office with the local council. So, you go through the local council and all of this sort of comes for you. And they would then get in touch vocally through this box, and you can talk anywhere in your house and they would hear it. So if you needed help, you could ask for help. So this was provided for me for free for a number of weeks post-surgery. And then if I wanted to continue, then there was a charge. So that was the local council. Through all of these people, I discovered that there was a GP service. I think it's called GP prescriber. Wendy would know better than me. And this is somebody who through the GP would refer you to. And if, for example, I'm a keen searcher online, and I was able to make phone calls, and I was assertive enough to make my case. But if you're not comfortable doing that, you're not well enough, you don't have the stamina, this one person, the GP prescriber, could be your contact, and then they would search for you to see what services were available and would come back to you. And I found the GP prescriber extremely helpful, even though I could do a lot myself. But for example, I wanted to have a Wi-Fi type of bell because I was always afraid of my doorbell ringing because I was so slow moving to answer it. And I wanted something that was Wi-Fi operated so I could sit anywhere in the home. in my home and answer it and open it. And she did a lot of searching for me to find if such a thing was available and who could come and install. And she did not abandon me. You know, it was fantastic moral support. You know, she would call me. She would make an appointment, and via appointment would call me every week, pre-surgery, post-surgery, until I was discharged by the surgeons. And then we said our goodbyes, and I miss her. But you know, it was wonderful, wonderful
Okay, so
service.
I think in other areas, you're very lucky you had all of that in your area, aren't there? So maybe in other areas, I think you're talking about GP social prescribers is what you're talking about. So lots of GP surgeries have these people now who support GPs, and they would know of local resources. Other places to go to look for local resources will be places like Citizens Advice, and the occupational therapists through the hospital are a great source of information on what's available locally, and grants and so forth, and what you can and what you can get operatively. There is a lot of help out there.
Good,
What's
great.
next then, Mark? Thank
Let's
you.
move on to the surgery itself now. So if you could take us through, you know, the process, what you experienced of just like actually going in and having the surgery then. Let's start with, because I remember you did mention earlier how you were just kind of like struggling to walk around your home just before the surgery. So how did you physically get to the hospital to start with?
Yeah, so a dear friend took me, gave me a lift. I was asked to arrive at the hospital quite early. I can't remember whether it was 8 or 8:30. So, you know, I managed, I maneuvered myself into the car, and I had taken Ubers before, so I knew that this was possible. And we drove to the hospital, and there was almost no waiting, and I'm very grateful. I think one could get nervous if you're just waiting and twiddling your thumb. I went to the reception. They brought me a wheelchair, and somebody took me up to a private room. And then a whole succession of people came to visit me in this private room. So first of all, a nurse came, and again, she did some measurements. She took, I think she took blood pressure. I think she again weighed me. I think the weight is very important, probably for the anesthetist as well. And she asked me questions, and I was I had to avoid eating anything from the night before, so she confirmed that with me. They had told me that it was extremely important to be infection-free, so I had stopped actually seeing strangers. I had stopped, you know, I would not go to the hairdresser. I had a cleaner at that time, and she had a cold, and I told her not to come for a week or two before the surgery. So these were the precautions that I had taken. And the nurse was just confirming these things, that I had no cuts, I wasn't sneezing, I didn't have a cough, and all of that. So the nurse went away, the anesthetist came. He was a bit anxious about me having both hips done. He wasn't looking forward to keeping me under anesthetic for you know, a length of time. And I was a bit underweight at that time, but you know, I reassured him that I absolutely wanted the 2 hips at the same time. Then I mentioned I had 2 surgeons, and each one came separately. And they just came to chat, you know, hello, how are you? Don't worry about a thing. We'll all be there, and so on and so forth. Then somebody brought me a hospital gown. I changed into it, and they brought me a wheelchair to wheel me into the lift to go somewhere, I assume, for the anesthetic. And I have absolutely no idea how it happened that from the moment I sat in the wheelchair, I don't remember a thing. How they administered the anesthetic, I have absolutely no idea. I sat in the wheelchair. I do recall them maneuvering me through the door of this private room. The next time I was awake, somebody said, hello, we've done your right hip. It's been successful. We're now going to do the left hip. And that was my surgery. And then the next time after that, I woke up, I was in the recovery room. So I mean, they had attached some things to my forearm in readiness, you know, for if the blood transfusion was needed, and in readiness to administer the anesthetic. But how these clever people managed to do the anesthetic without me noticing, I have no idea. So I did not set eyes to anything, any equipment or anything at all in the anesthetic room or the surgery room. I just went out of the door of this private room and I was out.
Wonderful. Did you must have had a nice pre-med by the sound of it, perhaps?
They did not give me anything to drink. They did not. I have no idea. I wish I could have a conversation with them and ask how they did it. When I assumed they'd woken me up after the first hip surgery, and they said the right hip successful, and I said something, you know, quite inane, like, "Oh, excellent, thank you so much." Maybe if I had not spoken, they would, you know, try to see how I felt. But because I remember speaking quite pertly, you know, thank you. They immediately went on to do the left hip. So that was wonderful.
Wendy,
And then
sorry, Rebecca, one sec. Wendy, do you know the reason why they wake you up in between the two? Is that a normal
I
thing?
guess they probably, an anaesthetist wants to make sure that you're okay. So they would obviously have to turn you over to do the other one. So they probably would bring the anesthetic down in the last few minutes, and then they would turn you over, make sure everything is okay. It sounds as though if he was slightly nervous in the beginning, he just wants to make sure you were still okay to go ahead with the next one. So they would bring up the anesthesia a little bit and then take you back down again when they were ready to restart, by the sound of it.
yes, he was a little bit concerned. As I said, I was rather underweight. And I assume that, you know, there is a lot of blood loss as well during the surgery. But, you know, ahead of time, they had ordered extra blood for me. I mean, they are so beautifully prepared. You know, you really feel you are in safe, very experienced hands. And actually, I had read I had read so many things online, and I'd gone through the NICE, NICE, all that literature, and it actually had tracked my surgeon, you know, the number of operations he'd done, the type of operations, and I had full confidence, you know.
Absolutely, that's another important thing, you know, knowing who's doing it and how many have they done and that kind of thing, and what are their success rates. All surgeons have to have that information available now, which is very useful.
And
when
NICE,
I went by the way, sorry, just to clarify what NICE is, in case someone doesn't know what we're talking about, it's the National Institute for Clinical Excellence. That's correct, isn't it, Wendy?
Yeah, that's right.
Good.
Yeah.
So carry on, Rebecca.
Yes, and the day I went for the consultation with the surgeon, you know, prior to the surgery, the establishment worked like clockwork. You know, I arrived, somebody immediately came, and I arrived, you know, at least an hour early at that time. Somebody just immediately came and greeted me. I was immediately taken to take an X-ray. I was immediately taken to see the surgeons, then into the pre-op measurement room. I mean, it was absolute clockwork. You could not doubt that these people knew what they were doing, and they were doing this day after day after day for many, many years. So that really gives you confidence. You relax, and there's nothing else you can do. You have to put yourself in their hands, and you just relax and let them get on with it.
Excellent. So I tell you, let's now move post surgery. So that all sounds like it went really well. So you said you woke up in the recovery room. So let's start there. Like, how were you like immediately afterwards, and then how did that change the following weeks afterwards as well?
So I was in the recovery room for 2.5 days. I think a lot of people spend a lot less. So as I was becoming aware in the recovery room, I was aware of people, especially with the single knee operation. They would come in, they would wake up. A physiotherapist will come and have a chat with them. They will be ticked off, and they would go home. So I think that most people spend very little time in this recovery room. I was there, as I said, for 2.5 days, and I was in my happy zone. They were giving me a lot of morphine at the time. Obviously, I was under medication, and also they also were working like clockwork. I do recall that, I had lost a lot of blood during the surgery, and the first meal that I had, oh, it was so delicious. It was toast, butter, and jam, which I thoroughly enjoyed. And then I had a hot tea, and almost immediately I became, I just, began to faint. The next thing I remember, there were 6 or 7 people around me giving me an oxygen mask, attaching various things to me. So instantly this had registered, and they were monitoring all the computers in front of them. So instantly they came, and my blood pressure had dropped. And that's what happened. And immediately they sort of put me down into the horizontal position. They completely knew what they did. And very quickly I regained balance, and everything was fine. But because of that, I think they kept me a bit longer in the recovery room. And then I went for an X-ray for the surgeons. And during all that time, that I was in hospital a total of a week. And during all the time that I was in the recovery ward and then in the normal ward, the anesthetist and the 2 surgeons would come and chat with me on a daily basis. Just, hello, how are you? We've checked your X-ray. Everything is absolutely fine. Your blood pressure is fine. Your blood plasma is a little bit low. This is why you need to be careful. We need to be careful with you. So they would keep me informed. They would come and chat with me, as I said, on a daily basis, which was wonderful. I mean, I don't know how they found the time, given
That's what they're paid to do, Rebecca. Don't worry about that. That's part of the contract, talking to patients occasionally. So that was an interesting point you mentioned about. I mean, I think you were probably in the recovery place for longer, obviously, because you'd had double surgery, if you like, and they would obviously want to keep a very, very close eye on you. And that was interesting what you said about post-operative pain relief, because I think many people's experience is not quite as comfortable as that post-operatively. So I think that is probably because you were in there longer, you were able to get that prolonged period of immediate pre-operative morphine and so forth. So which is excellent. Morphine's not a good drug in the long run, but it's very, very good post-operatively, provided you are, of course, having the laxatives, because it causes constipation. So lots of people say would have a knee operation one day and then they would go home the next, and they may not necessarily, while they're in hospital, they may feel that their pain is under reasonable control, but then as soon as they get home, they suddenly realize, oh my goodness, this is definitely not under control, because those first couple of days can really, really hurt. So I think it's very, very important to have a discussion with the anaesthetist, who will probably be in charge of some of the pain relief, and the team that you're with, to make sure that you've got plenty of strong painkillers to take home with you. Just going home with a little bit of paracetamol really is not gonna cover this. You need much stronger pain relief, and you need to be able to get more. You said that your GP had given you some more, didn't you, post-operatively as well?
Yes. I mean, I have to admit that really in hospital, I experienced no pain at all. I was astonished. And what I told, the very first nurse who would listen to me in the recovery room, I said very clearly, please give me the maximum amount of painkillers you're allowed to, because
Exactly.
I want to get on my feet as quickly as possible. I
Exactly
do
so.
remember saying that. Yes.
I think that's really important, because the sooner you get up and the sooner you get moving, the better you're going to be. But if it hurts, it really hurts. And when you've had a new knee done, you may well have a lot of staples down the front of your knee, and just looking at it is pretty frightening, let alone trying to move it. So asking for maximum pain relief is very, obviously, if you don't need it, you don't need it. But if you need it, ask for it, for sure.
Yes, yes. And when I came home, I mean, before they discharge you, the hospital pharmacist, together with a nurse, at least in this hospital, came to see me, and they had written everything down, but they were also telling me all the medication they were giving me, and how I should be taking those. So they had given me some paracetamol and some morphine-based medication, and some other medications, you know, to keep the system going, as you said. And when my morphine-based medication was running out, I started to panic. And also at that time, I was much more mobile. So I was taking less morphine and I was moving around more. So I began to experience slight pain. And, you know, I think it was the memory of the awful pre-op pain, the pain of arthritis. I just did not want to experience pain at all. And so I got in touch with my GP, and I think that people were very sympathetic to me because I had both hips done. And the GP also prescribed some extra, you know, more of that morphine medication. And they left it to me to reduce it on a weekly basis so that I would eventually stop taking it. And I did take that responsibility very seriously. So I would reduce it. I would extend the number of hours between each pill. And I would eventually, you know, very quickly, I went down to 2 pills and then 1 pill and then 0. And that the first day of 0 was a strange day. I was up in the clouds. I mean, there was nothing wrong with it, but mercifully, I was off work. I was still on a leave of absence. I don't think I could focus on anything. You know, I would make weird mistakes. So that one day was strange. And then after that, there was no kind of cloudy mind. And there was no pain, mercifully, you know, it was all gone. So that was wonderful. One thing I did also in respect to preparation for pre-surgery, the question Mark had asked, was that I had prepared as much as I could in the flat. So I had cooked and frozen loads of food.
Mhm.
I had even cut up all my vegetables and frozen them. I had put all my pots and pans and plates and stuff on top of the counters. And this is because I read somewhere that this is what you should do. And I thought, well, that's wonderful, wonderful advice. So I did everything. So I didn't have to do a lot of domestic stuff. You know, I could concentrate on my physio exercises. I could enjoy, you know, relaxation. I had a huge amount of swelling and I had to lie down with my feet up, which meant that I could read a lot. I could listen to a lot of audiobooks and things like that. So, yes, so I mean, we were talking about medication and yes, you know, they were extremely helpful.
Excellent.
But you have to wean yourself away eventually, yes.
Excellent. So let's talk a little bit about, because we spoke about like your activity levels and like the physio work you did before surgery. Can you tell us a little bit about what happened after surgery then, like, you know, your sort of physical recovery?
Yes, so the hospital arranged for a domiciliary physiotherapist to come and visit me. So these are physiotherapists who come to your home. And again, I had more than one. 2 of them came together. I think that was it was just a mix up with their schedule, but it was helpful for me. And the physiotherapist actually was also like me, was a bit of a, you know, dance yoga person. So she knew exactly what I wanted to do. and she knew what I could be capable of doing. You know, we talked, and I told her, I want to do this and that, and this is what I can do. This is something I can't do. So she gave me a lot of focused exercises, primarily to keep, you know, my core strong and my muscles strong. And very quickly, again, she came with another one. Two of them came to take me out for a walk. And they thought that if there were two of them, it would be safer. Very, very carefully, they took me out for a walk. And first I was using 2 crutches, then 1 crutch, then 1 stick. And now I'm using a foldable stick, which I carry in my backpack. And if I'm in the street and it's very wet and very crowded, or if I'm in a crowded tube, I tend to use it. I still need that reassurance. But physically, I'm able to walk without any aid. I have the last time I went to my physio. She saw me with a stick, and I, you know, was still carrying a stick, and she decided to teach me a lesson, I think. So she's given me a comprehensive set of 12 exercises. Each one has to be done in 3 sets, each set 30 repetitions. She said, do this, and I don't ever want to see you with a stick. And they really work. I mean, you do 10 repetitions of, you know, whatever it is, and you feel all the right muscles working. And I do enjoy that. I appreciate that. For some people, this may be, you know, quite a difficult experience, but I do enjoy. And yes, they have made me, you know, fit and strong. I've gone back to my sun salutations. Don't dare to do the lotus. I don't dare to do a lot of yoga floor exercises, but I'm sure it'll come. My experience is that these things, I mean, I'm sure the body is working gradually towards improvement, but you suddenly feel the spurt of improvement. So one day I got out of bed and I realized after 15 minutes that I wasn't using any walking aid. You know, I hadn't even thought about it. I felt so comfortable getting up and walking around. That, you know, and one day I did a nice yoga forward bend. My back was, you know, crying out. I needed a stretch. I didn't even think about it. I did it. It felt completely comfortable. So I'm sure, you know, the recovery had taken all that long, but you suddenly realized, oh, I can do this. You know, I can do this exercise or that exercise. So activities are coming back.
Was there anything the surgeon said that you shouldn't be doing immediately after?
Oh, yes, it's also written for you in your discharge notes. The physiotherapist also says. So for me, I was to avoid crossing my knees, to bringing my knees further than my hips, and also bending down, you know, bending further than my waist. So there were these 3 things that I had to avoid. And for these reasons, really only for these reasons, that I needed home help, you know, to pull up my socks and, you know, to help me pull up my trousers and things like that, help wash my hair. It's that sort of thing that I needed help with.
Great, thank you.
Yes, and then they leave it to you. So, you know, after, of course, they follow up after a month, after 3 months. And also this hospital, I don't know whether all hospitals are like that. They have an online system, and they encourage you to keep in touch with them and ask questions on this online system. And I would ask a question, you know, on a Sunday evening, and before I went to bed, the answer would be there. So this was very well staffed, this service. So I would frequently ask, you know, can I do such and such an exercise? And the answer always was, be very careful, start it gently, see how you feel. So, you know, after a certain point, they would leave it to you to be careful and just to experiment gently.
Excellent. Well, thank you very much, Rebecca. So I do want to make sure we have a bit of time for everyone's questions as well. So I'm going to be firing these out. Whichever one of you two feel like you can, it's more for you. I'll direct it as best I can. But so the first question is like I asked my consultant, should I exercise or rest my hip? He said, whatever you want to do yourself. Do what do you say? I think we've covered that one quite well. Do exercise your hip, but
Definitely exercise. Definitely, definitely. Don't do nothing. The more you do, the better you'll be.
But exercise could mean lying on your back and just gently flexing your buttocks up. Just gently, flexing some muscles or turning your toes up. So if you think of exercise, if you think, oh my goodness, I have to, lift weights and stand up and sit down on a chair. I think it's far less intimidating if you appreciate that just a little bit can be extremely effective.
definitely. Oh, so someone else has also asked Rebecca if all of this that you've been through, was it NHS or private?
NHS, absolutely, and it's marvelous
Exactly how
service.
the NHS should be, isn't it? It's fantastic.
Okay, another one. This one would be for you, Rebecca, from your experience, I suppose. Do you sought help from the council, etc., prior to going to surgery, or will the hospital organise it for you when you leave?
No, I went to the council prior. And actually, there are two ways you can go to the council. One, the occupational health of the council. You can contact them directly, or you can ask your GP to refer you. And I did both ways, and both ways were equally effective. I was told that if you go via your GP, the service would be quicker, but actually both ways were effective, were quick. So I would completely recommend it. Certainly my counsel came through very well.
Excellent. Okay, so how bad should a knee be before having an operation? I've had cortisone injections, sodium hydrate injections for a few years and told on the NHS cannot give until I'm 65. I'm just 64. Will it be better to go private if my pain relief is not working anymore? Would it be better recovery if done earlier? Like it's like I'm walking with a stick and not able to bend much.
So the severity, or rather when surgery is done or not, is usually based on clinical grounds. In other words, if your knee is really bad and you can't use it, then you probably need surgery. And if injections are not working anymore, that's the time to think about surgery. We spoke to a couple of years ago, we did a webinar with a surgeon, and he says surgeons want to know if you're really struggling. They don't want you suffering in silence at home. So it might be worth recontacting your surgeon. I would definitely not go private. That's what the NHS is for. And is it better if done earlier? It very much depends. I mean, if you can manage a bit longer. But if you can't, get it done sooner. I would say. I think that's I've covered all of that. Yeah.
Yeah. Okay, let's see what else we've got. We've got a few more minutes left. My physio told me that hip recommendations are being changed such that I can do anything but stop if it hurts to stop.
Fair enough. I think that's good advice. Certain movements have been restricted because surgeons worry about hip dislocations, because the area is a little bit fragile immediately post-operatively, but that may well be true that they're doing different surgical techniques now, so they're changing their guidelines. Obviously, if it hurts a lot, stop, definitely.
Okay, so we've had a couple of questions about swimming post-op as well. So I'm just going to kind of amalgamate them all together, really, just to make this a bit easier. But so, like, Wendy, what do you think about like swimming?
Yeah, swimming, absolutely perfect. I mean, certain swimming movements where you've got your legs wide might hurt a bit, but it's good, very good for the muscles, and it takes you off weight bearing. So there was another comment there about swimming being fantastic, and someone has lost loads of weight. Really, really well done there, because that can make a big difference. Definitely swimming, just have to factor in the palaver of getting into the pool, getting dressed and so forth, because it's quite tiring to do swimming.
Okay, there's a question. This is definitely for you, Wendy. I'm not even probably sure I'm going to say this one right. Is aframazimid, I've definitely said that one wrong, being investigated as a pre-surgery option in the NHS?
Sorry, I don't know what that is. That might be a trade name for something.
Okay.
Email me separately about that one. Don't know that one.
Excellent. Okay. Okay, I'm due for right hip surgery on the 2nd of December, feeling very anxious. I've never had an operation before. Well, hopefully hearing Rebecca's the success she's had will hopefully, give you a bit of a boost for that one. And any advice, Rebecca?
My advice, actually, one of my students told me this. She was doing a project with me, and she said, if I do something, then I'm not anxious. If you sit and worry, of course you get anxious. But if you do something, keep occupied, do your physio, take a bit of a walk, read around the subject, prepare your house for post-surgery. As you're doing these things, I think you find anxiety just recedes. Anyway, that's my policy. Do something positive towards preparing.
Excellent. And also,
See that helps.
brilliant, thank you. And there's also another bit of advice. Someone else has shared their experience, saying that they were only after their surgery, they were only in the recovery room for an hour. The op was Saturday morning, lasted an hour, and was walking home on Monday afternoon. So lots and lots of good stories. Really happy that that worked out for you as well. So thank you very much for that. So hopefully anyone who's a little bit worried about it, maybe you don't need to be as much now, because as you can see, there's so many great examples of all this going well.
One lady says quite correctly, if I said occupational health, I was wrong. I meant occupational therapy.
Ah, yes. I mean, they
Yes.
are. It is occupational health, but they are usually classed as occupational therapists. So yeah, but both work really. Thank you. And someone has asked, Rebecca, how is your knee?
Well, I haven't. The pain in the knee has gone away. So, I mean, Wendy would probably know the physiology of this. The pain must
Yeah,
have been radiating down.
exactly. So the nerve that works the hip also supplies the knee. So often knee pain can be due to a problem in the hip, as well as obviously a problem in the knee. So that must have been the cause.
I mean, the pathology is there. The torn meniscus, the arthritis is there, hasn't been repaired, but there's no pain whatsoever.
Excellent. Wonderful. And unfortunately, we are running really, really short on time now, so we are about to finish. But before you leave, if you would like any more information relating to arthritis or the topics we've discussed today, please visit our website, which is www.arthritisaction.org.uk. Got a whole selection of useful resources, to help you manage your condition better. And a video of this webinar, by the way, will be made available within the next week or so. It'll be on our YouTube channel, and I'll send you all a link as soon as it's ready of the recording for everyone who's registered here. And finally, just before we finish, I want to say a massive thank you to Wendy and Rebecca for giving us their time and answering all of your questions. And of course, thank you everyone else for joining. So I hope you all have a wonderful rest of the day, and I hope you see you all again soon.